Hi, I'm here with Liesl Blott. Good morning, Liesl. How are you?
Hi, how are you, Leah? Yeah,
I'm good. I'm good. Thank you so much for your phenomenal contribution to both of the textbooks. But today we're just talking about ACNM. What
thank
a
you.
mind you have. I mean, so many different medications and conditions, and you trawled through all the literature and helped us come up with that phenomenal chart that I know everyone just uses in clinics,
Thank
and it's
you.
color coded and everything.
It was a labour of love. It was when I started the project, I hadn't imagined it would actually be as much work as it turned out to be, but it was really important for me to get it right and to be accurate. And I think there was just, to me, when I was doing it and I was looking at some of the resources in terms of interactions that were available, I found a lot of the references were either didn't give enough information to know how one might change this, your prescribing patterns, or what, if it is it important, is it not? And some of them are also being put forward as significant interactions when it was based on some of the small in vivo studies. So it was important for me to be able to put that information in to allow practitioners to make an informed decision. I feel that there isn't really a body of work that really has that much information in one resource. So I was
Yeah.
very glad by the time I finished the work and was able to put that forward.
Yeah, no, look, and I love the fact that you can go, okay, I'm seeing X patient with Y condition and just look through it and know that you've covered everything and you don't have to be concerned about it. So I know people's feedback has been amazing and I'm so grateful that you can include it for all these complicated conditions.
Oh,
It's-
thank you. Thank
yeah.
you. Really
But
good.
what I'm really, really enjoying is getting a bit of an understanding about people's backgrounds. So how did naturopathy find you?
Well, I was first a pharmacist, and I think that was something that really was a great value in terms of this. But I was first a pharmacist, and when I moved from South Africa to Australia, it was an opportunity to sort of reinvent my life, look at what I wanted to do, and so I studied naturopathy and then went on to do a bachelor's of health science in herbal medicine. But it was just, for me, a lot of people would say, why, are you sort of going over to the dark side or whatever. I saw it just such as an extension of, there's so many ways to heal and to support people's health and well-being, and you don't have to be limited to one or other modality. So I became really passionate about integrative medicine and how, we're really looking at how can we optimize patient care, and to take out the drug therapy means they might not begin the therapy that they need, but to take out the complementary medicines, the natural therapies, you're not giving them the opportunity of supporting their well-being, of having preventative medicine, of being able to address some side effects, or so for me it became increasingly a passion to see how we can combine them for optimizing patient care.
Mm. And
So
if you could have your perfect scenario, where do you think it would be going? What direction would it head?
what complementary medicine,
Integration of them
integrative
both.
medicine, for me it is very much integrative medicine. I would love to see more integrative practices, and
Mm.
obviously there are some practitioners who have taken that on board, but I think to a large extent, until there's better reimbursement for complementary medicines and natural therapies, it's sort of recognized in a lot of areas as being a bit fringe.
Mm.
I think that, sort of, we're struggling to really have a fully integrative approach. And I
Mm.
think so many patients would really have improved healthcare if they could have that. So I would love to see that expanding. Um, at one point, I lectured at Curtin School of Pharmacy, and I introduced complementary medicines into the curriculum. And
Mm.
that was an absolute joy for me, because I love seeing these students coming in just really negative and thinking this is a useless unit, I don't need to know it, and there's no evidence. And then the progression over the semester and the excitement when they come to me and they say, oh, I've prescribed this, and patient came into the pharmacy, and this is what I recommended. Did you think I did the right thing?
And it
And, and,
worked.
and their growing excitement, and when I would, make them obviously do assignments and things where they'd look at the evidence, and it was really very rewarding for me. And I think that when we start having pharmacists, having doctors, having everyone have a greater exposure to complementary medicine, there'll
Mm.
be a greater adoption. But likewise, I think in the natural health arena, sometimes um, there's a bit of a, us and them mindset with some people. And I think as we can overcome that, we'll see better patient care coming out of it.
Absolutely, without doubt. Now, if I could say that you could have a grant for research in integrative medicine, what do you think are the top 5 areas that we need to start focusing on researching to integrate into all of the different medical communities?
Well, I think obviously cardiovascular health is always going to be critical because of how many people, have got cardiovascular disorders, and there's such phenomenal opportunity within the cardiovascular space to be able to have that combined integrated approach.
Yeah.
I think emotional well-being is a very important area, but it is a very difficult area because there is that difficulty with not wanting to treat people or miss a diagnosis, and so that is an area. But I definitely think there's a lot of supportive therapies, natural therapies, that a lot of patients with sort of milder presentations might really benefit from, and being able to work out, how do we do that in the most correct and accurate way that's supporting the patients without, not having them go forward for further assessment if that's what's required. So I think that's a really critical area. We've obviously seen now the whole wave of the importance of immunity. And, and I think that this is one area where complementary medicines, have really shown that, they've got something to help people. And there's been certainly, my experience has been there's been a tremendous increase in interest in complementary medicines to support people's sort of immunity. So I think that's another really great area. What would be my other top areas? Pain and joint pain, arthritis, all pain-related conditions. I think there's just such an opportunity there. For example, non-steroidal anti-inflammatories cause side effects. So if you can have somebody go on to complementary medicines that might, reduce their need for side effects, or and again integrative, so that they keep the drugs that cause more adverse effects for flare-ups, but then they can maintain themselves on drugs that are going to be a lot more kind, a lot less harmful. Yeah. So I think that's another really phenomenal area to get involved in.
Lucky last. What's the other area that you research towards?
What else can I think of just quickly? Women's health. I think that's a really, really phenomenal area, and I think across all spectrums, fertility, and I know that's something that's very much a passion for you. I think fertility is a tremendous opportunity where we can really, get women to be in their best state to be able to conceive and to be able to promote fertility. But throughout the spectrum, when we're looking at, women with PMS, and we're looking with menopausal women, and, there's concerns about the drug adverse effects. And again, we can support people to be able to use effective, appropriate complementary medicines, and they may not be perfect, but if you can reduce their symptoms enough that they're not requiring to go onto the drug therapies or not requiring it too soon, then that reduces the long-term risks associated with the hormone replacement therapies. So I think that's another great area.
No, totally agree. Well, he's hoping that someone listens and then asks you for this advice and puts more funding into the integration between the two, because, your chapter alone, I think, gives clinicians so much confidence, but I've also heard of people in the mainstream medical communities using the CNM integration supplements as well, and starting to look at it to use for them to understand the complementary access to things.
Great feedback.
Yeah, no, it's really, really good. So thank you again, and I know that everyone's going to look forward to seeing them because of all the specialised topics here. So appreciate it. Thanks, Lisa.
All right, thank you.